Hi, my name is Nicole Cummings Lewis. I'm the Senior Manager of Coalition Community Voice here at United Way for Greater Austin.
Hi, my name is Erin Dutton, and I'm the Family Engagement Manager with United Way for Success by Six.
We want to welcome you to the Family and Community Voice Strategies Input Survey. Our goal as a coalition is that all children enter kindergarten happy, healthy, and prepared to succeed in school and beyond. The Success by Six Coalition is a network of child and family advocates that includes providers, parents like yourself, policymakers, civic leaders, and even experts. And the goal is to work together to transform our early childhood educational system here in the Austin and Travis County and broader area. And that means whether you work, live, or play in this area. We recognize that the first 2,000 days of every person's life is foundational. There are tons of studies that show that a child's experience during those earlier times in their life literally builds the architecture of their brain. And so, driven by that data and the work that we do together, we build out this Success by Six coalition and the strategic planning process in order to make these early years most effective and most impactful for the students and the children in our community. I would love to share a little bit of background about our strategic planning process and the previous strategic plans that we've had. So, we've had one in 2012 to 2015. It used to be called the School Readiness Action Plan, and then one from 2015 to 2018. We are currently in our 2,000-day strategic plan, which you can see down there in the corner on the left side, and we are getting ready to move into our new strategic plan. Um, we really want to build on the strengths and the development of the previous strategic plans, but this time we really want to ensure that we're centering family voice and community voice through the lens of equity in our commitment to build a better community together. 2023 is the final year in the 2019-2023 strategic plan. That's the 2,000-day strategic planning that we just talked about. And we're going to continue to use the results-based accountability framework, both over the cycle of the strategic plan and on an annual basis. And that just means that we're going to continue to evaluate, assess, plan, and implement, and then continue to do that over and over again. Evaluate, assess, plan, and implement. And we are at the place where we are planning. We have done our evaluation. We have assessed all the things that we have done in this past strategic plan and what needs to happen moving forward. So we're in the planning process with you to be able to then implement our new strategic plan coming up here soon. Here is our strategic planning process. On this slide, you will notice that there are several moving pieces to make this work. First is the development of guiding principles and values, then the development of goals. Next is the development of strategies. And last is the development of action steps in order for us to implement a strategic plan. On the right side of the screen, you will see that there are various stakeholders that participate in making this happen. We use this and we call it a triangulation process. The first is that of the community, which is you. The second is the leadership team and work groups. The third is coalition organizations. That might be an organization where you learned about this opportunity from. We do this so that we can co-construct and build with and not for. As you can see in the top corner, you will notice we have already completed our guiding principles and values and the creation of our goals. We are currently in progress of creating our strategies. That's where you are. At each of the four phases on the previous slide, we recognize that our process is going to be messy like this ball of yarn. We might set a time frame and may not meet that because we want to make sure that we are bringing everyone to the table at every step of the process. So, as I've said before, we have completed the guiding principles and values. We have completed the goal statements. And now we are here at the strategies phase. Next, we will move on to the action steps and then implementation. We are so grateful that you're here to help us with the strategy phase. This is what we utilize in order to determine what we are going to prioritize and what we are going to be able to make decisions about and impact in our community. These decisions are grounded in our guiding principles and our equity anchor chart. These things are making sure that we're impacting systems change and systems impact. That means we're not trying to change one individual, we're trying to change the whole system. Those most directly affected are identified and they become priority in our work. We want to make sure that our coalition has agency to affect change in that problem that we're facing, and that those who can contribute, individuals like you, are actually involved and have a seat at the table. We also want to anticipate resistance and the barriers that may come our way that we may not have control over. Now that you have a little bit more information about the Success by Six Coalition and the strategic planning process, this is where you come in. We're going to turn our attention towards the 4 pillars that will be driving this work in our new strategic planning process. In this survey, you will get to give your feedback around the strategies that have been outlined for each pillar. Additionally, each strategy will also be outlined within the survey.
The first of the 4 areas that we will be focusing on, also known as pillars, is called Healthy Beginnings. The goal of this pillar is for families to feel empowered and have guidance to successfully navigate the medical and mental health systems and have the resources they need to meet developmental milestones before, during, and after birth, as well as through the child's first year of life. Now that you understand the goal of this pillar, we're going to talk a little bit about strategies in the next slide. Before we jump to that, let's talk a little bit about what we're asking feedback on. So, some questions for reflection. The first is, when we discuss the strategies, what in the list of strategies resonates with you or is exciting to you? The second is, what would you add to the list of strategies for this specific pillar, if there are any? And the third is there anything about how we explain the strategies or the information that we shared that might be unclear to you? For the first pillar, the Healthy Beginnings pillar, there are 4 suggested strategies. Keeping in mind the reflection questions we went over in the previous slide, I will now read the 4 strategies. The first one is development, screening, and referrals, to increase the number of low-income infants, toddlers, and families who are screened and successfully connected to necessary early childhood services. The second strategy is to strengthen relationships with pediatric providers to increase linkages between families with young children and service-providing agencies. The third strategy is culturally affirming prenatal and postnatal care, including optimal nutrition and lactation support provided by trusted healthcare providers and access to evidence-based perinatal and childbirth care in any setting the birthing parent chooses, such as a midwife, doula, or centering pregnancy. The fourth strategy is to strengthen and support organizations involved in perinatal health focused on eliminating racial disparities in birth outcomes and cultural humility. The second area of focus within Success by Six, or pillar, is called supported families. The goal of this pillar is for families to have access to resources to maintain and build on nurturing, responsive parent-child relationships while navigating the challenges of raising children prenatal to 6 years old. Within supported families, there are 3 suggested strategies. The first one is that parents and caregivers can successfully meet all of their basic needs, including housing, sufficient income, nutritionally rich, healthy food, reliable transportation, safe neighborhoods, and mental health services. The second strategy is that parents and caregivers have access to positive, culturally affirming, trauma informed parenting education services that enable them to access the knowledge and information about developmentally appropriate parenting practices when they desire or need them, that is also available in their home language and accessible in their community. The third suggested strategy is to increasing and supporting existing family care programs in languages other than English, keeping in mind the three reflection questions for these strategies. As a reminder, the first question is, what in these lists of strategies resonates with you or is exciting to you? The second is, would you add to this list of strategies for this pillar? And the third is there anything about how we explain the strategies or the information that we shared that might be unclear to you? The third focus area or pillar within Success by Six is called quality care and education. The goal of this pillar is for families to have access to affordable, high quality, equitable early care and education from birth to age 6. Within quality care and education, there are 8 suggested strategies. The first is to increase availability of high quality care in high need areas, including infant toddler care and child care deserts, and in programs with more than 20% to 40% enrollment supported by scholarships. The second suggested strategy is to recruit, develop, and retain a highly qualified early childhood workforce pipeline that provides equitable access to continuing education, career pathways, and compensation. The third suggested strategy is to improve access to and utilization of resources for children with special needs in the regulated childcare system. The fourth strategy states to improve financial sustainability of childcare programs through shared services and coaching. The fifth strategy is to increase access to resources for family based childcare centers in order to increase the number of programs that become licensed and registered and Texas Rising Star quality rated. Assure that early childhood caregivers have access to the technical assistance, professional development, and training needed to provide quality care to the children and families in Austin and Travis County. The fifth strategy continues on to provide opportunities for collaboration, which allow for the sharing of knowledge, best practices, and resources to better support providers. Recognize, support, and integrate family-based child care center programs as essential components of the early care and education system. Promote and support the importance of family-based child care centers as vital programs within the community. The sixth strategy is to generate additional sustainable funding sources for high-quality, affordable early care and education. The seventh strategy is to increase the number of eligible 3 and 4-year-old children enrolled in public pre-K school districts and other high-quality early education settings. And the last suggested strategy, the eighth suggested strategy, is that every district has and implements a plan to increase public pre-K quality and sociocultural equity, specifically for Black boys, through teacher professional development and classroom assessment data analysis. The last pillar within Success by Six is called Safe and Stimulating Communities. The goal of this pillar is that families experience Austin, Travis County as a child and family centered community that invests in and designs joyful learning opportunities that honor developmental needs, nurture healthy brain development, and ensure that children and families can thrive. The last pillar, the Safe and Stimulating Communities pillar, has 5 suggested strategies. The first is that the community has clear and equitable systems and processes, such as ways to engage, compensation, etc., in place to include and center the voice of families with lived experiences that remove barriers to participation throughout our coalition work. The second is that the community has connected and coordinated early childhood programs and resources that families can navigate. The third is that our community will collaborate to design and amplify shared messages that emphasize the paramount importance of prenatal to age 6 development and generate action from caregivers to policymakers. The fourth strategy is that our community will highlight existing environments and advocate for the development of safe and joyful spaces rooted in child-centered learning that is intentionally designed for all families. The last suggested strategy, the fifth one, is the public and private sectors will increase and align funding to support the importance of the prenatal to 6 developmental period. Keeping in mind these strategies, you want to reflect back to the questions: what in this list resonates with you or is exciting to you? What would you add to this list of strategies for this pillar? And is there anything about how we explain the strategies or the information we shared that might be unclear to you?
In closing, we just want to take the time to say thank you for your time, support, and dedication to our community.
We are here to support you, and we look forward to staying in contact with each other. If you'd like to continue the contact, ask questions, or just connect, please see our emails below.